Opioids are the most commonly prescribed medications for post-operative pain. So when starting an opioid regimen, it is important to start at the lowest dose and then work the dosage up appropriately. For patients who are receiving opioids for chronic pain, their dosage has to be raised frequently to maintain therapeutic effects. Opioids are awesome for acute pain. However, when you take opioids for chronic pain, the risk of opioid dependence increases. Diabetics and people with arthritis are at an increased risk for abusing opioids. The loss of analgesic efficacy can also be the result of opioid-induced hyperalgesia, which is when the body has an increased sensitivity to pain due to prolonged use of opioids. It is important for nurses to learn the peak effect times for the opioids they are going to be administering, and be aware that patients are at the highest risk at peak time and ensure assessment of respiratory status and sedation levels at those times. Once pain is identified, a multimodal treatment plan should be established, sparing the use of opioids as much as possible to minimize or eliminate common opioid side effects. It is important to note that the goal of analgesic agents is not to completely eliminate pain, but allow for pain to be manageable. Fentanyl is classified as an opioid analgesic. It works by inhibiting the ascending pain pathways in the central nervous system by binding to the opioid receptors, which increases pain threshold. It is a good drug in controlling moderate to severe pain in the pre-op, post-op client. It is primarily given IV, transdermal patch, lozenges, or a nasal spray. The onset for fentanyl is 3 to 5 minutes, peaks from 10 to 20 minutes, and the duration is 2 hours. The side effects are respiratory depression, respiratory arrest, bradycardia, cardiac arrest, and involuntary muscle movements. You should not consume alcohol while taking fentanyl. The black box warnings for fentanyl are excess heat can increase absorption. Your nursing assessment should be focused on the patient's respirations.
All right, so now we're going to be talking about morphine, which is just another opioid analgesic. It works by decreasing the pain impulse transmissions at the spinal cord level by interacting with opioid receptors, which you can see there with my lovely drawing of a spine, and the morphine binds that receptor. Next, we got the different routes you can give morphine through. You have IV, IM, sub-Q, and believe it or not, you can also get rectal, and of course by mouth. The onset of this med is within 5 to 10 minutes, with the peak of morphine being 15 to 30 minutes. And total duration that this med lasts is about 3 to 4 hours. Next, we have the adverse and side effects, which everybody pretty much knows as respiratory depression. And we have my lovely drawing here of some lungs that are sad, hence the name respiratory depression. And morphine can also cause respiratory arrest. Might have possibility of some bradycardia. And then could possibly also have cardiac arrest. And lastly, nausea, vomiting, and constipation, as portrayed by my little green stick emoji. Lastly, possible nursing assessments that you might want to think about, a little food for thought, is assess pain level. Obviously, since we are trying to control the pain, ask on a 0 to 10 scale. You want to next monitor vital signs, mainly focusing on, obviously, respiratory system. Then you want to monitor intake and output. Then lastly, you want to inform the patient to avoid alcohol, any other type of CNS depressants at all costs.
So we will be talking about Dilaudid. Dilaudid is an opioid. Opioid. So to start off, Dilaudid works by inhibiting the ascending pain pathways in the human body. So all these little red arrows are showing the direction of pain being brought up from the periphery up through the central nervous system into the brain. This little green syringe here is the Dilaudid. Once the Dilaudid is given, it blocks the pain pathways in the central nervous system, as shown here. So we're not severing this person's head. The green line merely indicates that we're blocking the pain pathways. He is okay. So I will be covering the IV push route. First of all, dosage will come in 0.2 to 1 milligram of Dilaudid per milliliter. Yes, that is correct. I cannot spell rate. I was a Marine grunt, have trouble with spelling. So the rate of push is 2 to 3 minutes. It's recommended that you dilute this Dilaudid with 5 milliliters of normal saline. This will enhance the rate of push. Make sure you're not giving too much too fast. So this guy here, push way too fast, he's going to have trouble breathing. Yep. Lips are a little cyanotic. Oh, a little bit of respiratory depression. Could even go into respiratory arrest. Yep, lungs are squeezed tight. This also has an effect on your blood pressure. It can cause a drop in blood pressure by increasing peripheral vasodilation. See, the little arrows here go to his arms and legs, indicating the peripheral vasodilation. And it will also decrease the heart rate. If you push too fast, the heart will stop. So don't push too fast. Thank you.